Hello and welcome to another in Radnor Township Board of Health's occasional series called Radnor Health Matters. Today we're going to talk about a topic that's quite important to the health of citizens of Radnor, and we're going to talk about Lyme disease. I have with me today Dr. Len Donato, who is a member of the Radnor Township Board of Health and a practicing veterinarian here in Radnor Township. And I also have Dr. Andrew Foreman, who is a pediatrician practicing in Paoli and who is a Radnor resident and a member of Radnor Township's Board of Health. Hello, gentlemen. Thank you for joining me today.
Thank you.
Lyme disease, as you both know, is a disease that's been named after a city in Connecticut, or really a small town, Old Lyme, Connecticut, where a number of cases were first identified in 1975. Although it was not till several years later that the bacterium that actually causes the disease, B. burgdorferi, was first identified. I want to ask you, Dr. Foreman, what is Lyme disease?
Well, Lyme disease is, like you said, a bacterial illness. It's caused by a corkscrew-shaped bacteria called Borrelia burgdorferi, which is a pathogen only found in ticks and transmitted to other animals, humans being one of them. The bacteria itself is detected in certain ways in the body, and we'll get into those discussions a little bit later, but it's basically a bacterial illness.
What about in pets? Is it the same bacterium that's the culprit?
It's the same bacterium, and the clinical signs, again, we can talk about later, but it is a little different in pets than in humans.
And that, I take it, is commonly called the black-legged tick. So for people who are looking in, that's maybe a term that's more familiar to them.
People also call them deer ticks as well, although they're not exclusive to deer. It's the common term for them as deer ticks.
Yeah, I want to talk a little bit about that. I'm glad you mentioned that, because we all have come to this point at some point referring to them as deer ticks, and then people get concerned when they see deer. And I know that you, Dr. Donato, have been at pains at various times, in my presence anyway, and probably when I'm not around, in trying to point out to people that it's not just deer. You want to take it?
The black-legged tick is on every wildlife creature pretty much that's out there. You have deer, but you have chipmunks and rabbits and skunks, raccoons, squirrels, any of the cute little fuzzy creatures you see wandering around your backyard will have them. And pretty much any mammal. We don't see them on birds. That's pretty much it.
And the black-legged tick, again, is carrying the bacterium which causes the disease.
Well,
actually.
And oddly enough, there's probably maybe 4 or 5 other species of tick in southeastern Pennsylvania that can carry Lyme, the Borrelia bacterium, and Lyme ticks that everybody generally refers to them, or the black-legged tick, are not the only ones.
So what you've mentioned that it's basically just mammals that aid in the reproduction and transmission of ticks, of these types of ticks.
Yeah, I mean, generally the ticks will, there's a whole life cycle for them. And generally the smaller, earlier stages of the tick generally head to the smaller mammals, and the larger and later stages, adult stages, generally go to the adults, which is why, again, I think the name deer tick has stuck with them, because it's thought that mainly they're on deer, but again, they're on all of the other larger mammals that we see, like, again, raccoons and skunks and groundhogs. Everything carries them.
But where do they live when they're not on an animal host?
They'll generally live in the taller grasses and shrubbery, places where the creatures we were just talking about like to hang out and hide.
Dr. Foreman, how are people exposed to these ticks?
Well, everyday life in this area, and there are certain parts of the country that's more common to see Lyme disease in. The southeastern United States, the northeastern United States on the coast here, we're a high area where there's a lot of Lyme disease. So people get exposed in their yards doing lawn work, in the woods, kids going to fetch balls out of the woods and things like this. Everyday life.
Sometimes you'll even see that pets are carrying them in, so that's where we encourage everybody to make sure they're treating their pets properly for ticks with certain products. So
if I take my dog for a walk on a grassy area, what should I do when I bring him in the house? Check him to see if
I think a tick check would be, is always a good idea. Again, they may just have 3 or 4 on them, but if you're petting your dog or cat or whatever was outside and they have ticks on them, they could easily crawl onto you. So you just want to do a nice tick check, make sure you're keeping up with the tick prevention, because the tick prevention products are not going to be a force field around the animals. They're going to pick up ticks, but with those products they'll die soon thereafter. Mm-hmm. So it's just a matter of being careful. It's not the main source. Mainly going out in the yard is when, and kids playing, and that's mainly where we see everybody picking up ticks. I picked one up, in fact, when I was out on a Boy Scout trip on my back. I got one, little hitchhiker.
Yeah, and in humans and children, we always encourage parents when they come in from outside to do a tick check. My general opinion on doing tick checks is not just visual, because these are pretty small creatures. These things are, in the size of a head of a pin size. When they're not fully full of blood, when they get a blood meal, they get larger. But when they're very small, it's much easier to kind of take your hands and just sort of rub over arms, legs, waist on your children's back, any exposed skin, and you can feel them a lot better than you can actually see them. So it almost feels like a little, something, a splinter on their skin, and you can identify that and remove it more easily.
Well, suppose you miss a tick that is carrying the bacterium that causes Lyme. What symptoms would you see in people,
Sure.
And how soon thereafter?
Well, a couple things first. There's different reports about this, but only between 3 and 10%, depending on where you read about them and where we are in the country, of these ticks actually carry the bacterium. So that being said, about 1 out of 10 ticks or so that you have on your body would possibly transmit Lyme disease. Ticks have to be latched on a certain amount of time before they transmit the disease through their secretions, their belly secretions into a human. Generally speaking, that's between 24 and 48 hours. So trying to get the tick off of the skin prior to that time period would be helpful to prevent the disease completely. However, you said you've missed a tick and you're not sure. It could have eaten and fallen off, and a child or an adult may present with a number of symptoms. Usually the early symptom of the actual disease is at the site of the bite. There would be a red circular mark. It's also known as a bullseye or a target lesion, meaning a clear center with a red outside. Can be the size of a silver dollar or larger, and it doesn't have to be completely round. It can be oblong or oval shaped. That's generally the first sign, and that's what we call early Lyme. And if that rash doesn't occur, and that occurs in about 75% or so of people, if that's missed or doesn't occur at all, the next stage sometimes would be multiple of these rashes all over the body, not just at the site of the tick bite. And that's where the rash gets its name, which means erythema migrans, which means redness that migrates around the body. So that might be the next stage that you might see. If that is missed or that doesn't occur, the next stage, generally in children, and I'm pretty sure in adults as well, can be joint symptoms, sometimes swelling of a joint, sometimes just limping or pain in the joint. In children, the most common joint, I think it's almost 10 to 1, is the knee, usually one-sided knee swelling or knee pain, limping. And then after that, the ankle, the shoulder, the elbow are common joints as well. So it is larger joints generally. And then if that's missed or that doesn't occur, the third or the final stages of Lyme disease can be various different symptoms, from heart issues to neurologic issues, brain issues, to chronic fatigue, to some other symptoms that are sometimes confused with other diseases. So it's difficult sometimes to figure out if this is Lyme symptoms or other diseases, multiple other diseases.
Dr. Donato, pets like cats and dogs, of course, have hair all over their body, so we're not going to be able to see that sort of bullseye or the rash, any evidence of that in the early stages. What would be the symptoms in our pets?
Yeah, and mainly dogs get Lyme disease. You won't see it in cats. For dogs, it is interesting we bring up the bullseye rash, because a lot of people come in with their dogs for bullseye rashes, and they look like bullseyes. It's actually allergy related. So that's one of the signs that you don't see in dogs. But the thing that we see most commonly is a dog that it was fine one day and all of a sudden will be very lethargic, may feel very warm to the touch, because these guys have a lot of high fevers. They'll not be moving. They may have multiple limb lameness, so usually it's not just in one leg, but it can be. And those common areas where we'll see some joint swelling is in the wrist or ankle, but it can be any joint. And then that's usually how they present, though they're very, very ill. There's a lot of other symptoms, but usually that's the case. Now, if you have a happy, healthy dog that's eating and running around and has lameness, most of the time it's actually not Lyme, but that's a big misconception that we see as well.
So it will take somewhere between 24 and 48 hours for these sorts of symptoms to begin to appear in...
Yeah. They can be bitten, at least animals-wise, they can be bitten by a tick and not show the symptoms for many weeks.
So it'll
And the
take
same goes for
longer.
humans. The same goes for humans. There's variation when the symptoms first appear. So you can get a reaction, a red circle bullseye rash in a human 24, 48 hours, or well, I should say 48, 72 hours after the tick has fallen off the body. But you can also see the first symptom up to 2 weeks, 3 weeks after the bite itself. It's variable.
So what if we suspect that we've got Lyme and go to a physician, what should we expect to happen? How would a physician confirm that diagnosis?
Well, I think that's kind of a little bit of a loaded question. People who come to the doctor suspecting they have Lyme disease can have a lot of things. If you come to the doctor and say, I was bitten by a tick, I found a tick on my body and removed it, don't know how long it was on, I think that there has to be some dialogue between the doctor and the patient about what to do next. The CDC guidelines and some other medical specialty advisory councils have recommended that we kind of work as a team and figure this out. So watch for symptoms of Lyme disease over a couple of weeks. Possibly discuss with the doctor, maybe I should get tested for Lyme in a few weeks. There's really no need to test right away because the tests are fairly useless that early on after a tick bite. So a discussion needs to happen about whether to get tested later on, whether to watch for symptoms. And some physicians actually decide to start antibiotics for some people, which we can discuss the treatments of later. But if you go to the doctor and say that you have symptoms of Lyme disease, for example, I have a bullseye rash, or I have a joint swelling, then your doctor has to make a decision about whether or not this looks like Lyme disease. In this area of the country, if you have a bullseye rash on your body, it's Lyme disease, and it should be treated as such. If you have one swollen joint in a child, you can presume Lyme disease, but you should probably check some lab work to confirm that, because there are other reasons for joint swelling. So it's really a discussion, I think, a lot between doctor and patient, determining if they think it's Lyme disease to just treat it.
And what about in dogs, Dr. Donato?
Yeah, in dogs, the testing for Lyme is very challenging. I usually approach Lyme disease as if it's a puzzle. There's not one test where you're going to go, oh, that's positive, so we have Lyme disease. It's more a puzzle, putting them all together, clinical signs, positive lab tests, not just Lyme tests, but other types like CBC. There's the response to treatment as well, because there's a few other diseases that will look exactly like Lyme in dogs. So I kind of generally approach it as it's a puzzle, and we gotta put the pieces together in the right order.
I have to ask either of you a question that I was chatting with a friend a few weeks ago and mentioning that we were preparing to do this program, and he said that as part of his annual workup, he where their laboratory tests and blood is taken for different purposes, but his physician apparently has that blood also checked for Lyme on an annual basis. Is that a valuable thing to do?
I think you have to understand what the lab work in humans is for, what the lab studies are for, and how they work. There's 2 tests in humans that have been approved and been confirmed by scientific evidence. One is called the ELISA test, and the other one is called the Western blot test. Both of these tests are pretty good for Lyme disease itself. However, they're not the all-encompassing answer to decide if you have Lyme or not. So getting a blood workup at a physical exam just to see if you have Lyme disease is not a very useful tool. These tests check to see your own body's response to the bacteria, not whether or not the bacteria is in your body. So your body is exposed to Lyme disease in 1987, and your body makes antibodies to Lyme disease. And if you checked your antibodies again in 2012, you may still have some antibodies to Lyme disease, but that does not mean that you currently have Lyme disease. So those tests are useful when you have clinical symptoms, and they're useful under the investigation that you may be doing if someone thinks they may have Lyme disease, but it's not a great screening tool at all.
Now, we've talked a little bit about the products that are in use for pets to try to control ticks, and that will cause the ticks to die after a time. Is it hard to control ticks in pets and in people?
In pets, it's always a challenge because they don't necessarily tell you when they have a problem, and there may be ticks that they feel crawling on them, and they'll turn around to bite it, and the tick will have moved. And the other strange thing with just related to that is a tick will release a little anesthetic before they bite you, so you can't feel the bite for the most part, and that makes it a little more challenging. Plus, they always climb up to the highest place, so usually that's behind the neck, where most people or animals don't generally feel or have a paw or a mouth or a hand on. So as far as controlling the ticks, though, for animals, it is a challenge. There's nothing that's going to act like a force field around them. They will get ticks. It's going to happen. They don't know not to go in certain areas.
So now we're talking a little bit about prevention. And what should people do, for example, Dr. Foreman?
Well, I think the 2 medicines that are 2 products that are excellent for preventing ticks would be DEET and permethrin, and these 2 are available over the counter pharmacies, supermarkets, etc. And different brand name products contain DEET. The recommendation is 20% DEET or greater to repel ticks. Again, these aren't the end-all force fields for people or children, but they're helpful. We generally tell patients that if you're applying DEET to your own skin, you want to apply it to the cuffs and the areas that ticks would get into. If you're wearing long pants or long sleeves, you would expose skin as well. You might want to apply some too. There are products out there marketed that I've seen that contain permethrin inside the clothing that actually last for 40 or 50 or 60 washings, and you can wear that clothing outside to prevent ticks as well. I think DEET is a relatively safe product, and I think it's a good idea to apply that when your kids are going outside and playing in the spring and the summer months. And I generally like to apply it to a tissue and then wipe it on exposed skin rather than spraying it and getting it in eyes and face where it can be irritating. But it's a fairly decent bug repellent and tick repellent.
And I would suppose that neither of you would recommend going out and doing yard work wearing shorts and sandals and short sleeve shirts.
If you're willing to do some good tick checking, I guess it can be done. But yeah, I try to apply my DEET when I go outside and do gardening work.
There was something that Dr. Foreman said about the time of year, and I'll say that, you know, we have a number of animals that come in, even in the winter months and late fall, and just any time of year. Probably about 10% of the animals we see will be bringing in ticks, even in the winter months, and it'll happen because we're the only ones outside at that point. A lot of the animals have gone and hibernated, or you know, just not as active as they would be during the summer months. So the only thing left out there are us and our pets.
Yeah, and reading for this presentation, I was very surprised to see how hardy these ticks are. I was reading a couple of articles, just, you know, didn't hear this before, but they emerge even after solid frosts and solid freezes. They just emerge and start looking for feeding, you know, so it's interesting, yeah. And we still do see some cases of Lyme disease through the winter. I think we've always kind of chalked it up to saying, well, maybe they were exposed at, you know, right at the end of fall or something, but I think you're right, they're probably, the kids are out there walking their pets and playing around in the yard, and there's going to be some bugs still out there.
Yeah, some of these ticks can, when it cools off, they actually can detect heat up to 30 feet away. Wow. And prime themselves on a branch or a blade of grass, or, you know, any little piece of shrubbery. So it's they're pretty clever little creatures.
So all the tests have been done, as you know, when they are determined to be necessary by the physician or veterinarian. And you confirm a diagnosis of Lyme. What happens then? What are the treatments and how effective are they? And Dr. Foreman, why don't you go first?
Well, with you know, Lyme disease, like I said, a lot of times it's a clinical diagnosis. I look at a child, I say, they have erythema migrans, this is Lyme disease, there's no need for testing, we're just going to treat. And oftentimes, you know, that's the case. I'd say 60, 70% of the time, that's the case. So we give, there's some recommendations on what to do at this stage. Early in Lyme treatment, we use about 14 days of antibiotics, simple antibiotics actually, ones that you use for ear infections and strep throat work very well. In children, amoxicillin is the one that we use most often. And that's a 14-day course. If it's found a little bit later into the joints, where the joints are swollen, or even into the third stage where other organs are involved, then we would use 21 to 28 days of antibiotics, the same antibiotic. The recommended medication for adults is doxycycline, and doxycycline generally isn't used in children under 8 or 9 years of age because it can affect their teeth. And it's also not used in pregnant women because it can also affect the teeth of a fetus. So we want to use amoxicillin probably also in pregnant women. So again, it's the number of days that changes based upon what stage of Lyme disease we think that the person is in.
What about the treatment course for pets?
It's pretty similar. Same antibiotics are used, amoxicillin or doxycycline. There are some dogs that will develop an issue with their kidney where the immune complexes that are formed by the presence of the disease will actually attack the kidney, and those dogs can become very, very ill, and they can die from it. And it doesn't necessarily have to be late in their disease process. They may be normal at one moment, and then all of a sudden they have this issue with their kidneys. And there's a lot of reasons for kidney disease, so you know, typically we don't jump right to that, but we do see that as a clinical entity, and that's the treatment of that is very intensive.
There's some theory in humans as well that there may be some immune complexes involved as well in long-term Lyme issues, chronic Lyme issues. And no one's exactly 100% sure, but sometimes there has been some evidence to show us that there are some immune complexes that occur in joints on a long-term basis as well from the body's fighting off of the bacteria, not the actual bacteria itself, but something called an OSP antigen. And that makes the joint swollen for a longer period of time than even after Lyme is out of the body.
Well, without the intervention of the tick that we've been talking about, can Lyme be contagious from one person to another, or from pet to human, or pet to pet?
Not that I know of, not that I've read about. I think it's the only transmission is through a tick to a human, or tick to a dog, or tick to another animal.
So if my dog has been diagnosed with Lyme, no one in my family is in direct danger from coming.
Not from the dog, but
Not from
if
the
the
dog.
ticks in the yard are having Lyme, then yes, they should be concerned more from that angle.
Can Lyme remain dormant in the body and reappear at a later time without, again, being reinfected by another tick?
Yeah, again, I don't think there's any evidence to show us that Lyme disease remains dormant for a period of time and then reemerges at some point. There's just not a whole lot of scientific evidence behind that. There's a lot of theories from people that can occur, but there has yet to be any science to prove that.
I asked that question because so many people believe that once you've got Lyme, you always have Lyme. And what they're referencing, I believe, and correct me if I'm wrong, is the fact that they will always have the antibodies.
Yeah, I think that's confusing for people. When you have a positive Lyme test, quote unquote, it's actually your own body's immune system that has responded to Lyme in the past. It does not necessarily mean you still have the disease.
Is that the same mechanism for pets?
Same thing, yes.
Yeah. But the presence of the antibodies does not mean that if you 10 years later go out in your yard and get bitten by a tick and don't know it at that point, that you couldn't again get Lyme. But that would be a new infection.
Right. And that's where the second test, this Western blot test, is very useful. The Western blot test is also called a band test. So if you can picture, there are many different bands on this test that they look at, and each band represents a different protein on the Lyme bacteria's surface. And because there are different strains of this bacteria, it's not just one bacteria that does this. So if you look at your bands on your Western blot test, it may be different from one time you have Lyme disease to another. So that's, again, where the conversation has to happen between the doctor and the patient to figure out, is this a new case of Lyme disease or is this your old antibodies that are there?
Now, you alluded to the particular circumstances of a pregnant woman. What should a pregnant woman actually do if she suspects she has Lyme?
Yeah, I think it's the same as a other adult would do. Contact your doctor. They may be more aggressive in either treating or testing, simply because it's two lives. So, but simply the same kind of thing. If you see a rash, if you have suspicion of a tick bite, to contact your doctor and have that conversation.
But again, the treatment regimen might be different for a pregnant woman than for an adult who is not pregnant.
Simply from the choice of the antibiotics and sort of that decision that's sort of between the patient, the pregnant woman and their doctor about, is the risk of treatment worth it to the fetus, although the risk of antibiotics is generally pretty safe for fetuses.
Before we conclude, let me ask either of you if there are any additional points you'd like our viewers to be aware of.
I would say it's all about prevention of the ticks. And I think that's really going to be the thing that takes care of the problem before we even have one. So I think tick checks and treating pets, and even some landscaping in the yard. If you have a lot of shrubs that are coming into the yard, that you should kind of cut those back if you can. And there's creative landscaping where there's stone borders that can be used, because as those stones heat up, it's not a really good transition for the ticks. Heat is a pretty good deterrent for them. If they have the option of going one way or the other, they'll take the way that's not the stones with the hot sun beating on them. So it's a lot of prevention in my mind.
Agreed completely. I mean, with children, in my experience, it's all about prevention. Obviously, this is a worrisome thing for parents, especially in this area of the world, because there's so much of it. I always, with any disease process, I stress a good dialogue with your doctor and being able to trust their opinions and give your own opinions about what you think is going on. So the right diagnosis can be made and the right treatment can be given if it's necessary.
So again, the best way to deal with Lyme is to keep yourselves from getting it in the first place by some of the prevention methods we've discussed this morning. I want to thank both Drs. Donato and Foreman for joining us today and providing what I think was a really informative session on Lyme disease. But if you want some more information, there is a website that you can go to, It's and it'll appear on your screens. www.cdc.gov/lyme/FAQ/index.html. Thank you very much.
Good stuff.
Thanks, Sam.